Um, okay, next up we have Harriet Churchill. So, Dr. Harriet Churchill is a lecturer in social work at the University of Sheffield, whose academic and teaching interests are in the areas of social policy, childhood family studies, family support, and children's services. Harriet is committed to promoting progressive, evidence informed policy and practice in the interests of children's rights, family welfare, social inclusion, and social equality. So, welcome, Harriet. If you could turn on your video and microphone, that would be lovely. And I'll hand over to you. Thank you very much.
Hi, good afternoon, everyone. Thanks, Joe. Gosh, just such, I hope you can see me. I can't actually see myself on there at the moment. But just such powerful presentations and testimonies so far this afternoon. I hope my presentation isn't going to be more on the dry side, but I've got some slides which hopefully are going to be put up. That's brilliant. Oh, that's brilliant. Thank you. So just to introduce myself a bit. So hello, I'm Harriet Churchill. Yeah, I'm a researcher based at the Department of Sociological Studies, University of Sheffield, and I've done some research studies into mainly family support services and sort of integrated models of family support, community-based family support services, and children's centres, and looking at initiatives around parenting, support for parents and young people who are teenagers. But the main thing I'm going to talk about this afternoon in my slot is to really emphasize, totally echoing several things that have already been said much more eloquently this afternoon, about the vital importance of reinvesting, but also developing in new and much more community empowerment ways, community-based and community building support and services for children and young people. So could I go for the next slide, please? So I know we're all aware of this, but the broader context to the urgency, not only of profound children's social care reform, but also much broader societal and welfare state reform to safeguard and promote children's rights and to create a much fairer and, as we've heard, compassionate society. The broader context to this is the dire and worsening trends and circumstances around childhood disadvantage, inequalities, and concerns around children's and young people's welfare and health, for example. So I know you'll all be aware of this, but in the pre-pandemic context, in the decade leading up to the pandemic, we saw significant worsening of these key trends. So if we look, for example, at rates of child poverty as measured by our official measure for looking at the proportion of children growing up in significantly low income households, we saw an increase of up to a third of children being classified as growing up in poverty in this sense from 2013 to 2017. If we look at, I'm being quite selective and kind of using headline kind of data here. I haven't quite got time to go into the complexities of the data, but just to highlight some really concerning trends here. So in terms of prevalence of diagnosed mental health problems, we saw this rising to 11.2% according to official kind of data for 5 to 15-year-olds by 2017. And then a key element of these issues is, I suppose, one thing to say about those trends, first of all, is that's not, you know, that's not to appreciate that the majority of children and young people are growing up in loving and caring households and families where parents really go above and beyond. But the scale of the pressures and the disadvantages are really systematically linked to poorer outcomes for children in terms and young people in terms of their longer term prospects, in terms of educational inequalities, health inequalities, and to some extent welfare concerns as well. And you know, it's the concerning rates even before the pandemic of increasing trends such as the number of children and families in temporary accommodation, for example, using food banks, experiencing very severe poverty. And when society and the state, in a sense, doesn't prioritize children's needs and children's rights, then we shouldn't really be too surprised when we see that happening in the community and in some families as well. So it's a massive indictment of our society and social policy to have allowed these trends to escalate. And I suppose a key feature in terms of engaging with the children's social care debate then is the austerity measures during this period, the reduction in funding for local government and for local authorities, and the degree, therefore, that this has led to cutbacks in spending and in provision levels in relation to things like early help services, community services, family support services, youth services, and kind of preventative programs around health and welfare and educational support. And at the same time, aligned with that, we see quite stark increases even before the pandemic in terms of referrals to children's social care, assessments for children in need, investigations around children at significant risk, numbers of young people in care, etc. So we see an increase in the proportion that local authorities have to dedicate their lower level of spending to fulfilling their statutory duties in terms of children's welfare and safeguarding and the care system. Although we see a reduction in spending per head in those regards because of the increasing number of children, of cases and children in care, etc. And so we see an even more of a pressure on those important broader community preventative measures. Okay, if we can move to the next slide. Thank you. Just getting aware of time. So then also, I don't think I need to kind of highlight this too much. I know, again, you'll all be very aware of the pandemic situation and the heightened pressures of the pandemic situation on family life across the board, family life more broadly and in children's lives. And it's the disproportionate as well as extensive implications of the health and socioeconomic negative impacts of the pandemic. I think the pandemic very pertinently indicated to us the importance of understanding the interlinked stresses that can occur in family life and on communities and on young people, and how therefore we need social systems of support and a welfare state and community infrastructures that recognize the interconnected nature of our needs and our various and the various potential kind of risks and protections in our lives. So thinking about the importance of economic needs, employment situations, the digital divide being key to children's disadvantage, particularly in keeping up with school learning during the pandemic, health issues, links with homeschooling and the different pressures that parents and families and in terms of their resources and support available for them during the pandemic, pressures on family relationships, etc., and how all of these things kind of have compounded so that we need to make sure the recovery around the pandemic is a social recovery, a well-being recovery, as well as a more narrowly a kind of economic or educational type recovery for families, communities, and children. So during the pandemic, we've seen much heightened increase of families in terms of economic struggles and insecurities, increases in claims of universal credit, which itself operates as a huge poverty trap potentially for claimants. Start kind of data and concerns around mental health issues, around levels of inequalities that have been widened during the pandemic. But we also see much potential learning around innovations in community outreach, the resourcefulness, the resilience, the creativity of communities, of the public sector, of the third sector, of really trying to mobilize resources, the finite resources that had been dwindling in the previous years, mobilizing resources and the left standing infrastructure that was available to provide that emergency and much needed social support response. There's much potential for lessons there. However, many communities didn't start off the pandemic with the kind of community infrastructure that perhaps would have enabled a more extensive emergency response initially. Okay, moving on to the next slide. So I want to just particularly emphasize, therefore, that kind of part of the children's social care reform debate is to particularly reinvest and redesign and expand our emphasis on investment and development in community-based support and services, as well as community building initiatives, which we've heard about both of these in really good detail already. And I just wanted to highlight kind of key research evidence here, which builds on the powerful kind of personal testimonies that are critical, that provide urgent lessons and messages, and the real practice expertise that people working in the front line of these services bring to our discussion and debate about a radical reform of children's social care, and more broadly children's and families services and support. So thinking about Sure Start and children's centres, for example, providing community-based multi-agency interprofessional services for families with young children. When children's services and Sure Start services offer a broad range of services and really connect with communities and add to communities resources, facilities, so that families and parents can get together and build their social networks and in an in-depth way, a comprehensive way, collaboratively work with professionals to identify and address local needs. Then we see these centres providing really effective, holistic, responsive, accessible, and collaborative early years and early help services. Importantly, they have the scope to promote community involvement and community building, really strengthening community resources and leading to empowerment and giving people voice and influence, and self-help initiatives to extent in that way. We see evidence that children's centres, when they provide high quality services coupled with highly subsidized but still high quality preschool and childcare provision, really fundamental for the early years in communities for young children. We see evidence of improvements in child health, development, parent-child relationships, positive parenting practices, home environments, routines, that kind of thing, and particularly maternal well-being and feelings of coping and managing and feeling more informed and having greater capabilities as a parent. We also see much more effective referrals to services through connections between services and therefore a better meeting of needs and services in that kind of early intervention, early help sense, but also reduce pressures on then more late intervention health and social care services. We've got currently a more recent emphasis on extending children's centres, the children's centres that are still operating, and extending these into the idea of family hubs, so providing a wider range of support and services for parents and families and children and young people of an older age, going up to the older teenage years, so providing a wider range of family support, key connections to health and education support services, but also a focus on young people much more extensively. And there's emerging evidence that these can deliver also more holistic and responsive forms of whole family support involving parents and young people in a family. And we also see evidence of some of these ideas of a broader kind of family centres, family support hubs, which might be sometimes they're called family relationship hubs or restorative practice hubs, where there's a focus on locality level developments across services as well as in centres, and having dedicated kind of locality focused practitioners in promoting relationship-based practice with families, family strengths-based practices with families, restorative practices, and strengthening links between different support services and early help and youth services, etc. And again, we see this as having a key evidence of having a key role in reducing demands, sort of the indicators of excessive demands on children's social care. So for example, local authorities that have really invested in family relationship centres or family integrated models of family support and training of a shared approach towards relationship-based practice and strengths-based practice across professionals from different backgrounds. In those local authorities, they've been bucking the national trend, and they're actually been seeing declining rates of officially classified children in need, children at risk, or children going into the care system, for example. So, okay, brilliant. Next slide, please. So just to highlight also, it's already been mentioned, for example, that another approach to promoting accessible and holistic community support and services is co-locating services around schools. And there's good evidence that co-locating generic family support workers or mental health teams of mental health workers, for example, and social workers within schools can help to not only improve outcomes for children in school, their welfare and their learning in engagement in school, but also provide essential family support and link up families and young people effectively with the spectrum of targeted and specialist and further universal services. There are a number of critical issues to consider in relation to developing these models, though. Firstly, the cost-cutting agenda has obviously reduced scope for these services, and where services do still exist, they might be providing a narrow range of services, and particularly have moved away from a broader community engagement, open access, community orientation. Part of the cost-cutting agenda is to reflect on the development in family hubs as well. In some senses, children's centres are being encouraged to expand their scope for co-located services without a sufficient attention being given to some of the problems in moving from serving families with preschool children to families with older children. And particularly the research there is showing that young people, although they indicate they might engage, they could engage with a family hub, they might go along to a family hub, they don't want it to be seen as a place that you go when you've got problems. They want these spaces to be adapted to young people, to be youth friendly. They want them to be seen as kind of community centres with activities for them to do, for them to access opportunities, but perhaps also access support. But they don't want them to, they don't feel that they would engage with those centres if they are primarily seen as as providing targeted support when you've got particular issues. Then there's key issues around these services also paying attention to socioeconomic issues, needing to have dedicated community orientated kind of link workers and roles and activities, particularly need to improve support and engagement for fathers and all sectors of the community, and particularly involve young people in the design, development and delivery of services. So I'll just move to the next slide and highlight just a couple of things here and then finish off. So as we've already heard, it's important to also develop community building kind of infrastructure and resources and assets and partnerships with communities. This is critical in order to kind of, so that we're not thinking about community services merely in terms of early help and support, which is obviously critical for individuals and families, but we're also thinking about building resources and capabilities that provide more voice and influence for children, young people and families that compensate for disadvantage, and in many ways can enhance kind of community level safeguarding and prevention in terms of child welfare concerns for children and young people. So I'll finish up there, but just to say what we need to be thinking about here is not only things like community libraries that are vital. It's about initiatives like maintaining parks well, community buildings, having community allotments, gardens, events, etc. Things that build communities and make people get involved in and develop their neighborhood, but also critically wide-ranging partnerships with children, young people and families so that they can set the agenda, they can co-produce initiatives and collaborate with the public sector, with the third sector to really develop communities for children and young people and that provide sufficient social support.
Great, thank you very much, Harriet, for that talk. Lots of amazing, quite stark statistics there, but it's great to have some positive outcomes and outputs at the end there, and some positive recommendations for what we can take forward. So thank you very much, Harriet.